Are you aware that the most dangerous items in your home might not be your cleaning supplies or tools, but are actually in your medicine cabinet? While we trust that medications are safe because they're FDA approved and prescribed by our doctors, the reality is sometimes more complicated. In today's video, we'll expose 6 common medications that can cause heart attacks, including some that you might be using right now for diabetes, pain relief, and even common colds. From the over-the-counter pills that we pop without a second thought to prescriptions that millions rely on, you'll discover how these medications could be undermining your heart health, often without any visible symptoms. Let's begin with the most commonly consumed, NSAIDs. Non-steroidal anti-inflammatory drugs, or NSAIDs, are commonly used for pain relief and inflammation control. That's things like ibuprofen, aspirin, and naproxen. Because they're sold over the counter and without prescription, it's easier to think that they're completely safe. But they can pose significant health risks. NSAIDs work by inhibiting enzymes called COX-1 and COX-2, which reduce pain and inflammation. However, this inhibition can also lead to serious side effects. Blocking COX-1 can cause gastrointestinal issues due to reduced protection in the stomach lining, while inhibiting COX-2 has been linked to increased cardiovascular risks. This is because COX-2 produces substances that keep blood vessels clear and blood flowing smoothly. Therefore, when COX-2 is inhibited, there's a higher risk of blood clots, hypertension, and heart attacks. Several studies have highlighted these risks. One study in the prestigious Lancet journal showed that certain NSAIDs increased the risk of major cardiovascular events by about a third compared to placebo. Drugs like ibuprofen and diclofenac were associated with highest risk. Naproxen still showed risk with long-term use, but the study deemed it to be generally safer for heart attack specifically. On the flip side, naproxen is believed to be more likely to cause gastrointestinal side effects like stomach ulcers and bleeding. As you can see, no drug is completely free from risk, especially at higher doses or when used long-term. That's why it's important to use these drugs only when necessary and at minimum doses. People with existing heart or liver conditions or anyone taking other medications should be especially cautious. Anti-inflammatories can interact with many medications, including common ones prescribed for heart disease, including antihypertensives like ACE inhibitors, anticoagulants like warfarin, beta blockers, digoxin, and even seemingly innocent ones like aspirin. So talk to your doctor first for anyone buying over-the-counter pain relievers without a prescription. The general rule is to never use them for longer than 10 days unless directed. And you know that annoying page of tiny text instructions? Read that and keep it with your medication. That's actually very important. When you take any medication, you're putting powerful chemicals into your body, so it's vital to follow dosage instructions correctly. Understand how it may interact with food, alcohol, or other medications, and know about any side effects to look out for. Plus, the simple fact is that you know your body and medical history better than any doctor trying to serve you in 15 minutes. So it's always best to stay informed, understand what you're putting in your body, and raise any concerns. Later, we've got more common over-the-counter drugs to be careful with. But at number 5, we have medications for erectile dysfunction. The most common form of ED medications are known as phosphodiesterase type 5 or PDE5 inhibitors. Common forms include Viagra, Levitra, and Cialis. You may know that ED is often an early warning sign for heart disease, That's because conditions such as atherosclerosis, where your arteries become narrow and damaged, not only block blood flow to the heart, but also to the arms, legs, and sexual organs. PDE5 inhibitors promote vasodilation, relaxing the smooth muscles in the walls of the arteries, which allow more blood to flow through. This works wonders for sexual function, but the cardiovascular system is a finely tuned machine. When arteries open more than the body naturally expects, it can also impact blood pressure and overall cardiovascular function. For people with heart disease or hypertension, this vasodilatory effect on ED medications can strain the heart, especially if it's already weak. We've got another common medication that has a similar artery relaxing effect coming up shortly that everyone should be aware of. But first, PDE5 medications are also known to interact with nitrates, which are often prescribed for heart conditions. Again, this combination can lead to a significant drop in blood pressure, potentially triggering heart attack. Now, erectile dysfunction is frustrating, but there are more natural ways to combat it with far less risk. For more on that, watch our video on 6 incredible ways to prevent erectile dysfunction. These tips aren't only for men with ED, but can essentially improve artery function for any person. We'll leave a link to that in the description box. Next, heart disease and diabetes go hand in hand, but unfortunately, there are 3 commonly prescribed diabetes medications that can actually increase heart attack risk, yet are still available on the market. First, metformin. Metformin works in various ways to reduce blood sugar levels, decreasing glucose production in the liver, improving the body's response to insulin, and reducing glucose absorption in the gut. Quite impressive really. But the problem is, metformin can cause serious trouble if you have kidney problems, and an estimated 30 to 50% of type 2 diabetics have kidney disease, many without knowing it. The main concern here is a side effect called lactic acidosis. This happens when lactic acid builds up in your body faster than it can be removed. Normally, your liver converts lactate into glucose, but when metformin inhibits this pathway, lactate accumulates. If lactic acidosis occurs, it can lead to muscle pain, trouble breathing, and even cardiac arrest. Similarly to metformin, thiazolidinedione-based medications increase the body's sensitivity to insulin. They do this by increasing the sensitivity of muscle, fat, and liver cells to insulin, allowing these cells to remove glucose from the blood more effectively. While effective in controlling blood sugar, thiazolidinediones can cause fluid retention. Fluid retention increases the volume of blood that the heart needs to handle, and for a weak heart, this additional workload can worsen symptoms like shortness of breath, swelling in the legs, and fatigue, as well as increasing the risk for heart attacks. And our third diabetes medication to be aware of are dipeptidyl peptidase 4, or DPP-4 inhibitors. Common types include sitagliptin, saxagliptin, and linagliptin. These actually increase insulin secretion. However, a number of studies have found increased heart failure risk with DPP-4 inhibitors. In fact, researchers from the University of South Australia looked at 9 different sets of data and found a 15% increase in the risk of heart failure in the people who took DPP-4 inhibitors. So if you're taking any of these medications and are concerned, talk to your doctor about potentially switching. There may be better alternatives, but equally there could be valid reasons why you're currently prescribed metformin, thiazolidinediones, or DDP-4 inhibitors. And of course, naturally reducing the need for these medications is most ideal. Next, decongestant nasal sprays are another unsuspecting culprit that can potentially increase the risk of heart attack. Studies show that decongestants like pseudoephedrine can increase systolic blood pressure, which exacerbates underlying heart conditions and can trigger cardiac events. Additionally, decongestants interact with many medications and health conditions, potentially increasing the risk of arrhythmias, hypertension, palpitations, and tachycardia. Furthermore, overuse of decongestant nasal sprays can also lead to a condition called rebound rhinitis, where congestion worsens once the decongestant wears off, making them more or less useless over the long term. It is crucial to be cautious with decongestants, especially if you have heart disease, high blood pressure, thyroid disease, diabetes, or any other health condition for that matter. Talk to your doctor first and investigate how the chemicals you're ingesting may interact with other medications or health conditions. Next, tricyclic antidepressants, or TCAs. These drugs, used primarily to treat depression, can increase the risk for heart attacks due to their impact on cardiac electrical activity. TCAs block the reuptake of neurotransmitters like norepinephrine and serotonin, which not only alleviates mood symptoms, but also affects cardiac ion channels. This action can lead to disturbances in heart rhythm, such as tachycardia, where the heart beats faster than normal. Tachycardia strains the heart, increasing demand for oxygen while reducing the time your heart has to fill with blood, ultimately heightening the risk of heart complications. Research has shown that the use of TCAs can also lead to cardiomyopathy, a condition where the heart muscle becomes enlarged, thick, or rigid, increasing the risk for heart failure. In comparison, selective serotonin reuptake inhibitors, or SSRIs, a newer class of antidepressants, are generally considered safer. SSRIs selectively inhibit the reuptake of serotonin without significantly affecting other neurotransmitters, or ion channels, which ultimately minimizes their cardiovascular effects. That said, both TCAs and SSRIs can interact with other medications, particularly those that also influence serotonin levels, like anti-nausea medications, triptans, mood stabilizers, and opioids. St. John's wort is a popular herbal supplement that can be purchased without a prescription. However, it can also interfere with these drugs, seriously increasing heart attack risk. So, as always, consult with a healthcare provider before starting any new treatment, including herbal supplements. And at number 1, we have diltiazem. Diltiazem is a calcium channel blocker used to treat high blood pressure and angina chest pain. It works by relaxing blood vessels and slowing the heart rate, improving blood flow and lowering blood pressure. A significant concern with diltiazem is its negative inotropic effect, meaning it can weaken the heart's contractions. This means that it may cause an abnormally slow heart rate, especially those with pre-existing heart conditions. Diltiazem has also been associated with rare instances of liver injury, which is less common but extremely serious. Diltiazem is not typically a first-line option for managing high blood pressure, so if your doctor has prescribed diltiazem before trying other options, you might consider having another conversation with them, or seeking a second opinion. And of course, aiming to avoid or reduce medication dependence is the best way to go, because all medications come with side effects. For a simple shopping list to get you on track, you might like to watch our video on 10 amazing foods that unclog arteries. We'll leave a link in the description, or click the link on screen.